This Q&A is not a personal time for me to ask questions about myself, but the next question on our list, everyone will be excited to hear. I also have floaters, and it seems a lot of our audience experiences floaters as well and has questions about them. The first being, what causes floaters? And the second being, is there anything that they can do about that? And to that end, is vision potentially going to be helpful with resolving floaters? Which I'm really looking for your answer on this.
What is a floater is an actual particle in the eye. So it's not something that's like psychometric or psychological. It's actually due to proteins inside the eyeball. So the eye is a hollow sphere, kind of like a ping pong ball. There's a space in the center, and when we're a um, uh, a developing fetus, there's a blood vessel that runs from the back of the eye to the front of the eye to help supply blood to the front of the eye so it can develop. So that the iris, the color part of your eye, and the lens and the cornea can develop. And then before we're even born, that vessel then obliterates and becomes a jelly. It fills up that center of the hollow sphere. So I like to tell patients that's like jello inside your eye. And when you're young, that jello is very solid and dense. But as we age, and this process, I'm not talking about people who might consider themselves old or young. It's when you're 10 years old, this process starts. So it starts when you're 10, and that jelly starts to melt. So then I tell patients it's almost like you make jello and then you sit it out in the sun and it starts to liquefy. So you end up with a jello like portion and a watery portion, and it kind of sloshes around inside the center of your eye. And the vitreous gel is made up mostly of water, like everything in our bodies, right? We're 70% water. The eye jelly is even higher. It's over 90% water, but it's also made up of proteins and other things like hyaluronic acid. Um, and over time, as it starts to liquefy and melt, those protein strands will start to adhere to each other and then precipitate off solution. So you will get like physical particles and physical strands that end up floating around in that jelly and in that watery substance that's in your eye. And as it kind of sways and moves into your vision, that's what we perceive as a floater, because light will hit that particle and then that particle will cast a shadow on your retina, and then we see the shadow as the floater itself. So that's what a floater is. We unfortunately, over the decades we're alive, the jelly liquefies and it forms more of these precipitates and of strands and little balls and webs, and we end up getting more floaters over time. Now, the bad news, Whitney, is unfortunately there's no way of getting rid of these floaters. In um, in I would say in mainstream medicine, it's very uh, unlikely to be able to get rid of these floaters. Now, there are kind of, I'd say, two mildly extreme ways of getting rid of them. One is to surgically remove them, which I don't typically recommend to many patients. But every now and then there'll be someone who has a really large one that's really blocking an essential portion of their vision, and they're, the like maybe it's affecting their profession. They are a flight air traffic controller and they can't see the radar screen, or they work under a microscope all the time and they can't, and it's interfering with their ability to look at pathologic slides. And in those rare cases, they may elect to have a surgical procedure where we actually surgically remove that jelly and the fluid from the back of the eye, which is done safely, but it's also riskier than not doing surgery. And so we typically advise patients against from doing the surgery. And on the other side, there's also another surgical option, which is a laser treatment, where doctors will use a laser that will evaporate and obliterate the floaters that are floating inside the eye. Um, that technique is, becoming more common, but it's not. I would say it's not mainstream at this point because there is a risk that that obliteration laser procedure can also cause damage to the structure inside the eye. So most ophthalmologists and most retina doctors don't perform that procedure currently in the United States. And it may change over time, and newer lasers may be invented that can help track these floaters and evaporate them more safely. But with the current technology, not a lot of eye doctors are doing that procedure. And I don't think that there's any sort of vitamins or, drinking extra water, for example, to keep the hydration level up. Unfortunately, I don't think any of those things would affect the formation of floaters or, um, eliminate them from the eye. Um, the last point, um, some people have asked, I think you can try to reduce the effect of the floater. So I think wearing sunglasses, like you were saying before, or trying to find lighting conditions that are more favorable that will hide and mask those floaters from your vision, I think is probably the best kind of coping mechanism that we have to, mitigate the effect of these.
I'm not a huge Jello fan to begin with, but now I will never be able to think about Jello or jelly again and not think of that explanation, which is super helpful. I guess for people who are big fans of Jello molds for Thanksgiving, uh, this is a great tie into that. Um, there are some people who did write in and said from taking supplements with the macular pigments in them that they did see an improvement in their floaters or they experienced that. Do you know why that is? If medically it's not resolving it, is it placebo effect? Is it potentially that something else is improving in the eye so you're not experiencing such a for me, they can be kind of distracting. It's not, super problematic, but I wonder, is there something else going on with the physiology that you can explain?
Sure, the placebo effect could be real, but also I think if you are taking carotenoid supplements and that's improving your macular function, that could have an effect on the perception of the floaters as well. Because as I was saying before, the floaters actually cast a shadow onto the retina, that which we're perceiving. And so, if our retinas are able to process light more effectively, reduce sort of contrast, edge effect, and so forth, maybe these floaters are becoming less bothersome to the people who are taking these supplements.
Right? Do cataracts have anything to do with the presence of floaters? Can we expect floaters to accompany cataracts or vice versa?
Cataracts don't typically accelerate the formation of floaters. However, um, they're not related, and but the older we get, the more lens opacification we get, which is a cataract. And so the cataracts accelerate as we age, and the number of floaters that accumulate as we age. And so they kind of go hand in hand. And so there could be an association between the density of cataract as well as the formation of floaters. But one thing that can happen is if you do get cataract surgery, where we remove the natural lens of the eye and replace it with a plastic lens, which allows us to focus the light more clearly, that surgery actually sometimes accelerates the floater formation because it does shift the jelly structure around the back of the eye a little bit. And that could accelerate the movement of the jelly from the back of the retina and can result in more floaters. Yeah, you can imagine that the natural lens of the eye has a certain volume. Like imagine a lens shaped structure, and when you remove that from the eye, you replace it with a very thin plastic lens, and so there's less volume kind of going back into the eye to replace that cataract that was bigger, and so all the jelly in behind that will then shift forward and a shift of volume can cause more floaters.